All right, pet owners, listen up. A mysterious respiratory illness is spreading among dogs.
And it's really worrying because it can be deadly and it doesn't appear to respond to antibiotics.
Now, as far as what we know, cases have been reported in several states. The illness is hard to distinguish, too, from a normal seasonal disease in dogs. Symptoms include a cough that can last several weeks, which can then progress to pneumonia, as well as a fever and loss of appetite.
Dr. David Needle joins us now. He's the pathology section chief at the New Hampshire Veterinary Diagnostic Lab. He's also a clinical associate professor at the University of New Hampshire. Dr. Needle, Errol and I both have dogs. We're dog lovers, so we're really concerned about this. And I understand that you actually started hearing about this illness a year ago. What have you seen since then?
So one thing to keep in mind is we're not 100% certain what's occurring in various states farther from New Hampshire are the same as what's happening in New Hampshire now or happened in New Hampshire previously. We have materials and swabs that have been sent to us from other states that we are in the process of analyzing, so we should know more in a few weeks. But what we did see is, like you said, a respiratory syndrome where dogs have chronic coughing and nasal discharge. Which can progress sometimes to pneumonia. There's a really low mortality rate based on what we have seen, based on the number of reported cases coming through clinics that we talk to people in. We are in the process of analyzing what potentially could be a new bacterial pathogen in these animals.
You know, people will hear this headline and freak out. I mean, my wife asked me to bring our dog Remy's Thanksgiving sweater to her in-laws as I head out there. So the extent that people will want to pay attention to this is huge. And we know this has been fatal for some dogs. But what exactly is it and how deadly is it, right? We don't want to freak people out, but how serious could this be?
So it appears that for the most part, the cases are more about a prolonged cough and respiratory disease that is longstanding and resistant to common treatments, and less about mortality. I think it's hard to feather out the fact that there are, like you said, seasonal upper respiratory diseases that occur in dogs, and there are dogs that get pneumonia and dogs that die, unfortunately, at all times. So separating out what's going on with that, it can be challenging. I think fear is not what should be motivating people, probably just being a little bit more conservative and concerned. And if you're in one of those states where there's a high incidence of this type of syndrome, that you should be a little more careful. New Hampshire in late 2022 had a lot more cases. Right now, it's pretty quiet here.
That's really interesting. Dr. Needle, there are going to be people who are watching Errol and I right now who are planning on boarding their dogs for Thanksgiving. They're making their plans for December now. Should they be concerned about their dog's health if they're going to be in one of these situations?
I think if you're in a place where there's a higher incidence of the disease, there's more risk for having more contact. We learned a lot about how to interact when there's a respiratory disease from what we went through in the last few years. So that's something worth considering. You know, you could get a house sitter or a dog walker or something like that.
All right, Dr. David Needle, thanks. Really important story. Appreciate you being with us.
Thank you very much.